Again, I'm Becky Royer. I am subcontracted by the State Office of Rural Health to lead the Medicare Beneficiary Quality Improvement Project. I do want to take a moment to thank Allie Orwig with the Indiana Rural Health Association for supporting Zoom for us today. She always does a great job. Zoom can sometimes be a little bit quirky with some of the recent updates. So contact Allie through the chat if you have any questions or concerns about Zoom. And I also have my email in the chat box, so you can email me and I'll connect with Allie and get your issues resolved. All the presentations, the agenda, and the call convening partner document that lists all of the partners that support the program today was sent out on Tuesday, April 20th to all of those who were registered. So if you don't have those presentations, contact me through that email and chat, and I'll make sure and get the presentations to you. We do encourage you to open up chat today so that you can, one, see all of the chat postings, and two, maybe connect with some of the individuals that are on the call today that you normally see at the Critical Access Hospital convening meeting and would like to reconnect with. We encourage you also to use the reaction button and also click on that participant list so that you can see everyone who is on the call today. But feel free to privately chat with one another and reach out and connect. I know we're all hoping to be able to see one another in person again soon. All of the lines were muted upon entry, so we encourage you to unmute your line if you have any questions throughout the day, and feel free to ask, or our team will be monitoring the chat and we'll make sure that those questions are addressed. To unmute your line, if you've connected via computer, if you hover over the bottom, there's a muting icon located there that you can mute or unmute. You can also click the microphone and mute and unmute yourself there by your name in the participant list. And you can also press the space bar on your computer and hold it down when you're speaking, and it will temporarily unmute your line. We are providing a recording of each session, so we'll be sending those out after the event today so that you can access a session that maybe you didn't have a chance to listen to all of it, or you want to forward to others in your hospital as appropriate. We will be having some breaks during the day. We'll be having a break in the morning, at lunch, and then the afternoon. And during those morning and afternoon breaks, Brent Anderson, the practice coach for chronic disease, primary care, and rural health at the Indiana Department of Health, is just going to take a few minutes and guide us with some wellness activities that will hopefully alleviate some stress. And we hope you enjoy today's program. And I'm going to turn it over to Karin Kennedy, the Vice President of Quality and Patient Safety at the Indiana Hospital Association, and she's going to open up the meeting for us. So Karin.
Thank you, Becky. Good morning, everybody. It's great to see so many on the call today in the webinar. I know when we first started these convening calls, these partner calls, when they were in person, I remember the partners sitting around and saying, "Oh, will people come? Will people come?" And it's just exciting to see that we're approaching 80 participants from critical access hospitals throughout Indiana. So I just wanted to acknowledge all the partners today that have brought this program together. The Indiana Hospital Association, which I represent. We have the Indiana Department of Health and its Office of Rural Health, the Indiana Department of Health and its Epidemiology Resource Center. We also have QSource, our Medicare Quality Improvement, QIO, Valiant Health Quality Solutions, which Becky's representing today, and then also the Indiana Rural Health Association. So we're really just excited to have this continued partnership. And at this time, I'm actually going to turn it over to Cara Veale for a few minutes. This is actually Cara's first critical access hospital partner virtual meeting with us. So I just wanted to introduce Cara as the the CEO of the Indiana Rural Health Association. So at this time, Cara, would you like to say a few words and welcome? And we're so grateful to have you as a partner.
Thanks, Karin. I appreciate the introduction. As Karin said, I'm Cara Veale. I am the CEO with the Indiana Rural Health Association. I've been with IRHA for almost 10 months now, which has been a very, very quick and unique 10 months. And I'm honored to have been blessed to work with such an incredible IRHA team and partner with such an incredible organization like the Indiana Hospital Association, the Indiana Department of Health, and those other organizations who are supporting today's convening session. Throughout my first 10 months with IRHA, I've had the opportunity to begin connecting both on-site and virtually with many of our critical access hospitals. And we at IRHA we're absolutely here to support all of our rural hospitals through our leadership, education, advocacy, collaboration, and resource development. And we recognize that there are many challenges that critical access hospitals and rural hospitals alike are facing, including legislative changes, reimbursement challenges, staffing shortages, and so much more. I do want to make a shameless plug that IRHA's annual conference is scheduled to be live and in person in June at French Lick. So I look forward to the opportunity to being on site again. I'm sure many of you are also in that same position. And I encourage each of you to attend, and I look forward to meeting all of you in person. So I do just want to say thanks again to Becky Royer, the Indiana Hospital Association, Indiana Department of Health, the Indiana State Office of Rural Health, and Q-Source for continuing these biannual meetings and for being so flexible to offer them virtually throughout this public health emergency. So I'm excited to be here, and thank you.
Thank you, Cara. I'm going to just roll through a few of the partner slides that we have just to provide just a few updates before I turn it over to David Conrad, because I'm standing in the way of Dr. Lindsay Weaver's presentation, who I just wanted to say thank you, Dr. Weaver, for all your leadership. As I just want to say just a couple words, I know as my friends and families will say, there's all this news media, and I constantly say I listen to two people, and that's the two people are Dr. Lindsay Weaver and Dr. Chris Box. And just thank you for your leadership, because I feel like the two of you are rock stars, and we owe so much gratitude for both of you. So with that, I just wanted to mention that Becky Royer will be putting on through Valiant Health some MB-Quip swing bed educational webinars. And those are June 8th and July 13th. And then also the regional quarterly webinars, which are held the following month on the 2nd and 3rd Tuesdays for an hour. So each critical access hospital will be assigned a date and a time. So watch out for those invitations coming. And then the telehealth educational webinar series, just won't read through each one of those, but you will be getting these slides as well. Lots of great information here on a three-part telehealth educational series that will be occurring throughout the next few months. And then the Indiana Hospital Association, I just want to point out that we have been distributing a vaccine acceptance toolkit and resources, and this is targeting healthcare worker vaccinations. You'll have the link to these resources. This is part of our HQuick contract that we have with Cynosure Health, which is ultimately CMS funded, but even if you're not participating in that project, you are welcome to these resources. IHA is working on our Inspire, which is the initiative that we're partnering with the Indiana Department of Health on making Indiana the best in the Midwest by 2014 and having the lowest infant mortality in the Midwest. So for those birthing hospitals, I know you've been receiving outreach on that topic. Here's some information about our infection prevention webinar series. We will have the next one on April 28th, and we are tying sepsis and infection prevention together into the next topic. Our sepsis office hours continue. Becky Hancock has been doing a great job keeping those up through the public health emergency. And so our next one is Tuesday, May 18th. And I also want to put a plug in for our 2021 Patient Safety Summit. So save the date for June 24th from 10 a.m. to 2 p.m. We are having our Patient Safety Summit held virtually, and our topic will be on health equity and the influences on patient safety and outcomes on that day, and have a couple of national speakers joining us. The Indiana Rural Health Association, Cara mentioned this. I think there should be like a game or a bet, like if we really get to have this in person, which I hope we really do, but who's going to be the first one to like do that friends when they walk in the door and their arms are up in the air, and I'm so excited to see each other. So really hopeful that we can do this in person on June 15th to the 16th at French Lick. It's going to definitely be a celebration if that we can do this. And the keynote speakers are Dr. Box and Dr. Jerome Adams is joining this day as well. So excited to see Dr. Adams back in Indiana. That's going to be just a great opportunity to hear from Dr. Adams. And I see somebody chime in. This is a great conference, so please sign up. And also on July 20th and 21st, the third annual Upper Midwest Telehealth Resource Center Conference will be occurring. And I know that Becky Sanders puts a lot of time and effort into this conference. So make sure you take advantage of this wonderful opportunity. So grateful to have Becky Sanders and all the great work that she does with telehealth in the state of Indiana. And QSource is having some town hall events. They've been doing a lot of work in long-term care. So they are having a webinar on April 22nd. That was actually would have been yesterday. So hopefully you took advantage of it. I know what QSource does a lot of recording of their webinars. So I'm sure that will be out for everybody to view. And then on April 29th, they will be joined by a panel of community leaders to share efforts and best practices. So they've been doing a lot of great work in helping to improve our COVID vaccination rates, which is really important to us right now, obviously, is that we've got to get those vaccination rates up and do everything we can to help the Department of Health and our local health departments, our hospitals, federally health qualified centers, and everybody that can possibly be giving shots in the arm. We need to be encouraging that and getting those rates up. And then it's time now that I'm going to turn it over to David Conrad from the Office of Rural Health. He's going to present some of the awards, which is so very important. This is what in the spring we've always been doing these awards. So at this time, I'm going to turn it over to you, David.
Thanks, Karin. Can everybody hear me okay? Hopefully, okay, cool. So I'm really excited to get to be here today. I've obviously been very busy helping with the COVID response. I've spent a lot of time over the last year working with the call center. And so that's been pulling a lot of my attention. So before I talk the Critical Access Hospital Awards, which is something I'm very passionate about, I really wanted to give a call out to all of the Flex partners who have kept up doing the work while I've been incredibly busy. But in particular, I really wanted to shout out Becky Royer. She's handled a lot of the MB-Quip stuff, making sure that stuff keeps going, making sure that this conference still happened. I'm usually able to be a lot more involved, but I wasn't able to make a lot of the meetings for this year. So I wanted to make sure to give Becky a shout out because she's really kept the Flex programs going in my absence while I've been helping with the COVID response, which is important as well. But it's meant a lot to know that it's been in such good hands. So I feel like talking about awards, it's really good to make sure to call her out for that too. Secondly, in terms of the awards, we're doing a couple slightly different things this year. We're kind of doing away with one that's specifically data driven because data's been all over the place the last year with everybody focusing so heavily on COVID response and making sure that that was really important. So we've kind of changed up the words a little bit this year. A couple different names, a couple different focuses, but in the end, each one of these is all going to be submitted based off of anybody who sends in a submission. You can submit for anyone. Just we really want to hear as many stories as possible, particularly with the last year that we've had. It would be really important for me, and I think for all of us, to really get to celebrate the good things that have happened. It's been a tough year. Everybody has been doing great work, and I really would like to celebrate that at the next conference that we have. So these applications are going to get distributed on Monday. So please look for these. Please, if you have anybody in mind for any of these 5 categories, go ahead and submit it for it. I would be happy to have to read through hundreds of submissions for this. It would be great to just get to hear and share all of these stories. So that's where I'm at. I'm actually going to be able to be around today. I made sure to have some time so that I could be here to help out and to hear all of the wonderful stuff that we've got planned for you today. Really excited for Dr. Weaver's update, since this is something that I've been working on so much with COVID. But I'm happy to get to be here. You might notice I'm a little bit tired. I just had, I'm now a father of 2, not even a week old yet. So it's been a very busy time for me. And I'm really grateful for all the work that our Flex partners have done. So I'll pass it off with that.
And I think Karin is still muted, but the next fall conference we are hoping to have on Tuesday, October the 19th, 2021, and hopefully it will be in person. So I'm going to turn it over now to Ashley Clodfelder. And Ashley, if you would like to go ahead, and we'll start with our first presentation.